You ready?
Mm-hmm.
Okay. Always get nervous. All right, so we're gonna start with contact precautions first. So if you have a patient that is on contact precautions, the mask is completely optional. However, I'm going to wear it because we are in COVID times. So you can do things a couple ways. Put your mask on. You want to refrain from your dirty hands or your hands without gloves on touching the inside of your mask because it's gonna be touching your face and ew, that's gross. So use your ear loops, put your mask on accordingly like this. Then you're going to flatten it out. This is like being really annoying. And you're going to smooth your nose piece down so it fits nice and snug across your nose. You don't necessarily want to pinch it because then you have room for air to escape. Now this is obviously going to be a one size fits all, so maybe a little big, but you want to smooth it down on the face. Have your mask on. Gown. You want to open your gown up to where the back is the part with the strings are on the back side. So you're going to put it on like a shirt, I guess. Now, people do things a little bit differently. Some people put their hand all the way through and then put their gloves on. I find that it's easier to take your finger, your thumb hole, make a thumb hole for yourself on both sides. Because when you put your gloves on, it's going to help keep this from riding up and your arms being exposed to whatever you're dealing with in the room. Then you're going to put your gloves on. This is not sterile, so this is not a specific procedure to do it. All right, so now you can tie this around if you want, or you can leave it open as whatever is comfortable for you. You can tie it around the neck piece. There's a neck part back here that you can tie, or around the waist if you don't want it coming off of you or constantly falling down and you're having to pull it up. So you can some people will tie the neck piece first and then slip their head through it. I just usually tie it around the waist, typically. Which this one's kind of janky, but that's okay. So, contact with a mask. Droplet will be the same way as I'm gowned up. And then, of course, you're airborne. You would wear your N95, and you can wear gown and gloves or just gloves and N95 mask. And then your contact enteric is going to be your gown and gloves and hand wash. And then your neutropenic is going to be all of this again. Okay? Now, you've gone in, you've assessed your patient, you've done all the things you need to do, you're getting ready to leave, and you're going to doff off your garb. A couple ways of doing it. So, for example, since I've already punched holes through my gown, I'm probably going to go ahead and take my gown off with my gloves because it makes sense to me instead of taking my gloves off and then having to turn around and whatever. So what you're going to do is you're going to take your gown and you're going to pop the strings or untie it. They just pop really easy if you tie them around your waist or around your neck. Pull them off. You want to make sure that you turn your arm, everything inside out, so all your yucky germs are on the inside of the gown or on the outside of the gown. Pull it through, keeping all of the clean part that touched you on the outside that you're touching. Roll it up, throw it in the trash. Then with your hands that are degloved, you can take your mask and pull it off by the ear loops. Okay. If you decide you want to keep your gloves on at the very end, what you would do is, I'll put some gloves on so you can see it. So say you take your gown off and you still have your gloves on. What you would do is, since your gloves are dirty, you would take your mask, pull it from the outside where it's yucky, not touching your face, and then you would pull it off your ears like this. And you would throw your mask in the trash. Then you would go wash your hands and do all your stuff, and then you walk out the room.